My name is Dr. Mike Crovetti. I am the creator and founder of the Surgical Recovery Suites model for outpatient joint replacement. About 10 years ago, you all might remember the Great Recession that occurred. Well, at that time, I was building a facility designed for orthopedic care. It included MRI, my office, a surgery center, internal medicine, cardiology. It was going to be my dream center, and still is today. But 10 years ago, in building the facility, I obviously borrowed some money from a bank. Well, that bank was taken over by the government. And this was one Friday night, about 5 o'clock, when we found out that all of our money, including the money to finish the facility, was gone. You can imagine what that weekend was like. After a couple of weeks, we decided we were going to cut the surgery center in half. Instead of a 4-room surgery center, we would do 2 rooms. As a result, that left 4,500 square feet of what we call a gray shell, which means it wasn't finished. And every day I walked past that for about 2 years. Finally, at the same time, my orthopedic practice was back on fire again. Joint replacements were changing dramatically in our community. Patients were no longer 70 and 75 years old. They were in their 40s, and hip replacements especially. I noted a bit of a crisis back then where it seemed like hip replacements were 40 and 50 and 60 years old. And same with knee replacements. My 55-year-old guys and gals, my outdoorsmen, we were becoming more popular. As a result of that, these were healthier patients that I wasn't sure they needed to be in the hospital any longer. At the same time, you might remember 10 years ago or so, MRSA infections and falls and complications were being duly noted in our town here in Las Vegas and Henderson. As a result of walking past this 4,500 square feet every day, I thought to myself, what if we put 6 really high-end hotel-like rooms in this center? What if these total joint replacement patients that were younger and healthier, what if they could have surgery in my surgery center? And then, after the surgery was over, maybe they could stay in my house as opposed to going to their house. So we didn't need a medical facility. We needed basically a place to take care of them, just as if we were going into their home. Well, in 2010, that all came to fruition because I went and I built the 6 rooms. Borrowed the last bit of money probably a bank was loaning anybody at that point, and we built the 6 rooms. The one thing we forgot was how to pay for it. Outpatient joint replacement was not a mainstay in orthopedics, and certainly in the reimbursement from commercial payers or Medicare for that matter. As a result, I went out to the insurance companies and I developed what's called a bundled rate. Bundled rates were becoming popular in Medicare. However, they just weren't apparent in the commercial payer arena. Therefore, I sat down, I started taking the medical directors and the contracting personnel and developing real relationships with the hand that feeds us, our payers. That relationship turned out, and still to this day, is fantastic. We put together a bundled rate, which would include the surgery center, the surgeon, the recovery suites and all its amenities for food and nursing and all of the personnel and a therapist to take care of everyone. And then we'd include the anesthesiologist in this as well. And of course, a top-of-the-rack implant, because these patients were so young, we had to have the best implants for them. Well, we're now fast forward about 10 years later. We're 2,500 patients we've completed. We've nearly eliminated all complications, and the recovery suites model has become what it is today. Bundle rates are becoming more popular among insurance companies, and I think our 2,500 patients and the reporting and the patient satisfaction, net promoter scores, everything just simply being top of the rack has changed the outpatient joint replacement arena. In retrospect, I guess I'm pretty glad the bank was taken over by the government, and who says that? But 10 years later, I couldn't be happier.